Hello everyone, welcome to StudyIQ English. Let's begin with asking a basic question. Which sustainable development goal do you think deals with good health and well-being for all by 2030? Yes, indeed it is SDG 3 that relates to this, but when we talk about India, when we talk about the healthcare sector, there is often a complaint that despite having seen the COVID-19 pandemic and the medical emergencies that erupted as a result of that, we as a society still are unable to spend even 5% of GDP into healthcare. Talking about primary health, still a lot of organizations like ASHA workers, ANMs, Anganwadi workers are devoting their life to taking care of the health needs of the poor, of the health needs in terms of last mile connectivity in India, because definitely there is a discrepancy when it comes to providing not just quality primary, secondary, tertiary healthcare services, but also most of the people who are working in the healthcare industry. Generally, it is women. Generally, it is considered a pink collar job, caretaking, health provision, but they are underpaid. They do not command the kind of salary that is required to boost their potential that they have a right to achieve. And all this is happening despite the fact that in 2019, we also passed the 4 new labor codes. A part of these labor codes is the Social Security Code 2020 and also the wage code. And despite that, right now in Kerala, there has been a major protest. Now, nurses in private hospitals in Kerala went on an indefinite strike. The strike started already last week. It was about 9th of March. And the strike still is impacting the essential services in the state. Why? Because the strike was held by UNA, United Nurses Association, and the issue today highlights labor rights versus essential services, especially in healthcare sector, and wage disparities, salary disparity between the private sector and the government hospital nurses. What should be the role of judiciary here? How can we create a balance between worker rights as well as primary health services? That's becoming a key question for us right now. So, looking at what exactly has happened now in Kerala, nurses in the private hospitals are having some clear-cut demands. What they are asking for is wage parity. They say that government hospital nurses are earning about 60,000 rupees per month. And on the other hand, it's the private hospital nurses that are not even able to secure a 20,000 rupees monthly salary. And that's a major gap between the two. The working hours, working schedules are very hectic, and the salary that they get is not sufficient. They therefore demand a complete revision of wages that should be about 40,000 basic pay, and this is a demand raised by United Nurses Association. They also complain of poor working conditions. They talk about long working hours, heavy workload because of less staff. Now, whenever we have spoken about LPG reforms in India, going back to 1991, we also discussed about SAP, Structural Adjustment Program. Now, a very normal part of privatization and liberalization is social dumping, where workers in the private sector, workers in the so-called informal sector are subjected to not just a poor wage, lack of social security, but also heavy work schedule. And this is not something that's only visible, say, in the urban unorganized sector, or say in the agriculture sector. It's quite visible in services like healthcare. And these nurses today are a living example of that at a low salary, too much work burden is now leading to a protest by them. Now, what about temporary employment? Now, most of these nurses, say about 1/3 of them, work as locum. They work as temporary staff. They do not get any benefit. They have no job security. And isn't it paradoxical that recently, under the Honorable Supreme Court's verdict, we are considering giving women paid menstrual leave? Now, in a society where we are navigating between implementing strongly the POSH Act, Prevention of Sexual Harassment at Work, giving women menstrual leave, giving women maternity benefit, all fulfilling obligations under Articles 42, Article 46 of the DPSP, directive principles of state policy, creating a welfare society. On the other hand, today there is a big group of medical professionals who aren't happy and they are complaining repeatedly. And this is not a new complaint. It has been there for quite some time now. Now, nurses in Kerala have been protesting for this since 2012. So it's nothing new. Today in 2020, we have formalized the 4 labor codes as I just mentioned, but the demand is very long back. It has been getting raised since 2012 and still nothing has been done much. And due to their protest, there was a weight change. Some revision was done by the government in 2013 and one more revision was done in 2018. But the United Nurses Association says it is not sufficient. It's a very tiny little amount as compared to the demand that they had created. After all, they need their own due amount in order to live a fulfilling life. They also need some money to feel gratified at work. At the same time, it is also about beating the inflationary pressure. Over the years, when wages do not raise, it translates into a poor living standard, and that's the demand that they are raising. Now, private hospital managements represented by Kerala Private Hospital Association, KPHA, has been opposing the strike. Now, whenever you talk about labor or trade union, when you talk about strike, then let me ask you a question. Now, India, which is a founding member of the ILO, International Labour Organization, from 1919, a body of UN that deals with creating wage parity, creating good working conditions for the labour across the world. It has 8 mandatory conventions, but India has signed only 6 out of these. The remaining 2 have not been signed by us. It's a very common question that we keep raising even in the Hindu newspaper class. So, can you tell me here in the comment box which 2 labour conventions, mandatory conventions of the ILO has India not signed? Now, let me give you a hint. Both of those talk about trade unionism. So in India, workers have had a long complaint. They say that through the ILO convention, or whether it's about the labor code, the 4 new labor codes from 2019, none of these actually focus on bargaining power of the labor. They have stripped off labor bodies from doing any kind of trade unionism, from doing a collective bargaining. And that's very bad for them. So today also, this body has criticized the strike and they say that it's illegal. They say that the government must cancel the strike because the government should invoke Essential Services Maintenance Act 1968, because ideally under this act, employees in essential service sectors like healthcare, say transportation, they have no right to go on indefinite strike, because then that creates a problem for the entire society. It creates a halting of basic economic process. So what does Kerala High Court say today? The Kerala High Court has ordered the government to ensure that hospital services should not be disrupted, because owing to the strike, there are many patients who are now unattended. It's creating a healthcare fury in the state. So that's why the High Court has said that it is the right of the patients to access medical care, and we need to protect that right. Definitely. You can say it relates to Article 21 of the Constitution. After all, the right to life and right to dignity is very much about right to basic medical health care. And that's why the Honorable High Court of Kerala says we must give the patients their basic right to well-being and health care. And therefore, it has asked the United Nurses Association to postpone the strike up till March 19. And after this order, the strike has been temporarily withdrawn. But there is no clarity it may revive in the future because the demands are unmet. At the same time, what do you mean by the Essential Services Maintenance Act 1968? A very important law. It's a parliamentary law designed to make sure that basic essential services in the society, in the economy, are not interrupted due to strikes or labor movements. And these essential sectors mean, of course, the primary is healthcare and then sanitation. You talk about transport, energy and water supply. These are the basic necessities, and therefore, since all these services are the backbone of public life, there is no right to create unnecessary strike. And if you still do it, you can attract imprisonment or fine if you're found guilty. So today, how would you summarize the situation? Is it actually about the workers demanding something that's belittling the whole idea of Essential Services Maintenance Act, or are they valid because they feel vulnerable because their basic economic demands are not getting met? So how would you categorize this topic? Think about it. Let me know in the comment box. And now here's a very UPSC style practice question for you. There is an assertion and a reasoning. Let me know if you can answer the question in the comment box. Assertion says the Kerala High Court directed the striking nurses, the ones who are on strike, to temporarily deter, that's postpone, cancel their agitation and ensure that hospital access remains unobstructed. The reasoning: healthcare services can be treated as essential services under this Act of 1968, and disruption of any such service could mean disrupting public access to critical medical health care. Which of these statements are true? Is it A, that both of them are correct and R is the right explanation of A? Is it B, that both are correct but R doesn't explain it? Is it C, A is true but R is false? Or is it D, that A is false but R is true? Let's see if you can try answering such questions, quite similar to what UPSC gives you. And now here's the QR code for my Telegram channel. Please scan it and be a part of our growing community where we share UPSC facts, questions, my Hindu PDFs, StudyIQ-led initiatives and all those important information bits that will help you in your exam. And now a quick reminder, we at StudyIQ are running a massive sale program for 2027 and 28 UPSC batches at a very throwaway price beginning from $13,999 for more than 1 year. We give you complete books, materials, PYQ, MCQ, current affairs, news, all big fours, GS paper, prelims, GS, all the papers 1 to 4 mains, then essay writing plus answer writing and one-on-one mentorship. All this at this humble price, and if you use my code SPLIVE to enroll for both these batches, 27 and 28, you get further discount. Now do remember, batches are beginning on 26th March. So you must enroll as a limited time offer, because once the batch starts, then it's a little too late to join in between. So enroll now, book your slot, even if you think that it's too early. It is actually never early for UPSC given the vast syllabus. So enroll today, whichever language medium you are. And remember, success comes when you make a timely plan, stick to it and start early. Only with us at StudyIQ. Thank you.